In this technical note, we present our inverting hip labral repair technique for inside-out labral tears. The following are our disclosures. Patients with hip dysplasia, such as this patient with a lateral center edge angle of 15.9, currently ready for his first stage hip arthroscopy prior to his second stage periacetabular osteotomy, can present with unique labral pathology called an inside-out labral tear. MR arthrogram demonstrates the cleft-like appearance of the chondrolabral delamination as well as the everted morphology of the labrum not in contact with the femoral head. These labral tears are distinct from tears found in patients with FAI in that the superiorly directed force of the femur against the dysplastic acetabulum drives the cartilage delamination and everted labral tearing as depicted here. The authors prefer supine patient positioning with a well-padded perineal post. Traction and fluoroscopic guidance are utilized to safely access the hip joint. Once visualization in the central compartment is safely established via the anterolateral portal, diagnostic arthroscopy is performed demonstrating a labral tear. As traction is let down in this patient, we can appreciate the lack of a native labral suction seal due to the labral tear and everted labral morphology depicted in the arrow. A distal anterolateral accessory portal is established under direct visualization. A curved drill guide is inserted over a nitinol guide wire in the Dalla portal. Using an inside-out technique, the drill guide is placed on the inner portion of the acetabular rim. Here you can appreciate the cleft-like chondrolabral delamination. A 1.4 mm peak knot tying suture anchor is utilized in this technique. A suture passing device is passed under the labrum and into the joint, careful not to iatrogenically damage the articular cartilage. The drill guide is left in the Dalla portal the entire time and utilized to facilitate suture retrieval and passage with the suture passage device. The suture is carefully passed around the labrum, and an arthroscopic grasper via a cannula in the mid-anterior portal is utilized to pass the suture outside the joint. The same arthroscopic grasper via the cannula in the mid-anterior portal is utilized to grab the other limb coming from the suture anchor. The suture limb on the acetabular side of the suture anchor is shortened, which will become the post when tying knots. An arthroscopic knot pusher is used to tie and secure the knots, performing the labral repair and inverting the labrum under appropriate tension. The knot is then cut using an arthroscopic knot cutter. Additional suture anchors can be placed as needed, utilizing the same technique to complete the labral repair. Fluoroscopic guidance can be useful to ensure adequate drill placement and trajectory within the bony acetabular rim. After drilling, the suture anchor is placed and the drill guide is once again left inside the Dalla portal. The suture passage device is again passed into the joint underneath the labrum. Once ready to retrieve the suture, the drill guide is used to help facilitate suture passage around the labrum. Suture passage in this fashion ensures that the labrum will be inverted at the time of repair. Via the cannula in the mid-anterior portal, the suture limbs are retrieved using an arthroscopic grasper, and the sutures are secured using arthroscopic knot tying techniques. Here we can appreciate the inverted appearance of the labrum as the sutures are cut and the repair is completed. The repair is examined to ensure that the entire extent of the labral tear has been addressed. Releasing and applying traction at this point demonstrates complete restoration of the labral suction seal status post successful repair. Thank you for your time and attention.